New York Representative Alexandria Ocasio-Cortez recently went viral for taking mega company CVS to task in what she described as a captive strategy where patients are being steered to get their medical, pharmaceutical, and other services from one organization's ecosystem. CVS, of course, has a totally different take, but I tend to agree with AOC, and I'm going to explain to you why in this upcoming roundup. Let's go. What's up, guys? It's your girl, Coach Tiff, for Beyond RCM Revenue Cycle Management in the cold state of New York. It is just so cold. And I know it's not only cold in New York, but it's cold all over the country. But thank you so much for taking the time to join us today in this RCM Roundup. If you are a returning viewer, welcome back to the channel. You know we always have relevant topics here on Beyond RCM related to evolving healthcare topics, whether you're a patient, a medical provider, or working in the healthcare administrative space. We aim to provide our viewers with information that keeps them in the know of what's happening in the healthcare space. So yes, Representative Alexandria Ocasio-Cortez recently took CVS executives to task in a House hearing where she broke down how this organization literally has a chokehold on certain parts of the market. Because oftentimes from the patient perspective, we don't understand how these different companies that go under different names may still be functioning under one big umbrella, which is what I believe AOC attempted to do as she broke down this captive strategy. So just to give you some insight into what I'm talking about, we know CVS as the pharmaceutical chain where we go to get our prescriptions filled. Many people do not know that CVS also has a pharmacy benefits management company known as Caremark, and that they also own health insurance giant Aetna. So why does all of this matter? When one company has their hand in different parts of the healthcare ecosystem, so for example, pharmaceutical benefits, health insurance needs, and being able to even open clinics in different parts of the country, well, what that does is that means that that organization has a lot of influence in terms of, for example, what drugs get placed on the formulary for their pharmacy benefits management organization. Hey, what's up? Just stopping by really quick to make a quick ask. We've been reviewing our data analytics and we've noticed that we have tons of new individuals checking out our channel, which is geared towards all things healthcare. However, many of our viewers are not subscribed to our channel. Subscribing to our channel allows our content to go into the proper algorithms so that we can spread knowledge related to the healthcare industry to all those who are interested or looking for guidance. So can you do me a favor? If you haven't done so already, can you please like, subscribe, and hit the notification bell? That allows our information to get into the hands of those who truly need it. Thank you so much for helping us out in this way. Let's continue being great together. That insurance company, i.e. Aetna, dictates what in-network rates will look like that ultimately affect provider bottom lines. And also with expansion into the clinical space, it means that it squeezes out competition for private practices to be able to sustain their practices. So for example, if you have a private practice that works in a underserved or urban area that previously relied on Aetna, but Aetna is shrinking the reimbursement rates for many of the services that they provide, that could actually force that provider out of business because they cannot afford the cost to keep their practice open based on their reimbursement rates. And I want to say that it's not only CVS and Aetna that has this type of, as AOC described, a captive strategy. Other companies like Cigna does the same thing under their umbrella company, Evernorth. United Healthcare also has a similar strategy with Optum. And speaking for myself here in New York, in the past, I want to say 12 months, I have seen a significant increase in the number of Optum clinics that are popping up in different areas. And I'm seeing more Optum clinics than I'm seeing private practices. In fact, I'm seeing more Optum clinics pop up than I am seeing private practices pop up. So that's another indication that by these larger companies being able to branch out into these different areas, how it creates a concentration in the market and makes it more difficult. Now, there have been inquiries by organizations like the FTC, the Federal Trade Commission, to really examine some of these models and whether or not if they pose a negative effect on our healthcare population and business models in general. But there has not been any major legislation to really curtail a lot of these companies from expanding fast and furiously. So I definitely think that it was important for House Representative Alexandria Ocasio-Cortez to paint this picture, because I don't think many patients understand how, many of these companies have multiple hands in the same pot. Back in the day, this would kind of be considered a monopoly. And, I'm not saying the people are out here doing a monopoly, so please don't sue me. I'm just saying back in the day. But today, the rules have changed somewhat. But I think it's important for us as patients and consumers of healthcare to understand how these companies are positioning themselves to really dominate the market and how it's having an adverse effect on many medical providers and many patients. So again, I thought that it was very relevant to have that discussion. I'm going to share some information in the link and description that you can review further. And just educate yourself on how a lot of these companies work, and how they are able to maximize their profits, and sometimes very much so at the detriment of the populations that they are charged with serving, and definitely at the risk of many medical providers. I can tell you firsthand, I have watched many private practices either have to merge with larger organizations or close their doors altogether, because over the years, they just continue to systematically get squeezed out with their reimbursement rates just dwindling and dwindling, and their malpractice insurance going higher and higher, and them just not being able to sustain the cost of having a practice. So I think that this was definitely a much needed discussion that needed to be put out into the public sphere so people could really educate themselves and understand how healthcare delivery works in the United States of America. If you felt that this information was beneficial and useful to you, I want you, if you have not done so already, to like, subscribe, and hit the notification bell. And we will be sure to continue to come out with relevant content for our ever-changing healthcare landscape here in the United States of America. I'm your girl, Coach Tiff. Thank you so much for taking the time to hang out with me. I will see you in the next roundup. Bye.